Hello, my fellow caretakers of chaos. I'm Professor Gina from Trauma Drama University, here with our new Tuesday Trauma Talk. Today, our topic is what else? Trauma behaviors. Some of you may be wondering if your child would qualify as a trauma kid, since maybe you can't identify the trauma, and yet you're still struggling and the parenting books just aren't working. Believe it or not, some traumas can happen in the womb, and also, any long separation from the biological mother, especially in that first year, can lead to trauma. That, of course, includes adopted and foster kids, but also instances like medical separation, deployment, or prison. Divorce of the parents in the first few years of life can be traumatic, especially if it was a volatile relationship before the separation. And of course, physical and emotional abuse or neglect. What kind of trauma isn't as important as when the trauma happens. Trauma in the first year of life can result in lifelong complications, where if a child has a solid foundation for their first few years of life and then suffers a trauma later on, they tend to bounce back faster. Yet every child is different. Two kids could have identical situations, but maybe one has a lower tolerance to stresses due to their DNA. And identifying the trauma isn't as important as helping our kids heal. Here are some behaviors that are typically considered trauma responses. Extreme anger, quick to trigger explosive violence, throwing, scratching, biting, spitting, punching holes in the walls, etc. Food hoarding or unusual eating habits are often a sign of neglect in the first year. The slightest hunger pang can send that child into fight or flight, so dinner just can't come fast enough. Or maybe you find bags of chips or cookies in their closets, drawers, or hidden under the bed. There is an emotional connection between food and love. So kids who suffered trauma tend to crave carbs and sugar. Those are the ones that simulate the feelings of love. Does that sound familiar? Poor impulse control, lying or stealing, inability to give or receive affection. Sometimes this is limited to the primary caregivers, and a child is overly affectionate with strangers. We call this parent shopping. These kids are subconsciously trying to protect themselves from further losses by looking towards the next thing. Lack of cause and effect thinking. Cause and effect is a kind of an important concept when parenting. If I do this, then this happens. If a child doesn't have this ability, no sticker chart or timeout chair is going to magically make them behave. In fact, that timeout chair can bring about feelings of isolation. That sticker chart may be a visual reminder that they just can't do anything right. This is an important one to know about. We need different tactics. Severe anxiety or depression. Does your child freak out in new situations, lock themselves in the bathroom before a test? That was mine. Or visit the nurse every day at school with tummy issues? That was mine too. Preoccupation with blood, fire, and gore. Maybe they tell you about horrifying nightmares or draw pictures of decapitations. Or they just can't be trusted with matches. Executive function issues and or learning lags. If your teachers are suggesting attention deficit disorder, it might be a symptom of trauma. Other executive functions include the ability to plan, remember instructions, or juggle multiple tasks. They also include self-control. And finally, bedwetting far beyond the normal age and or urinating around the house. I knew someone whose son would pee down the vents. Gotta love the cleanup bill for that. Some kids will poop their pants or smear their feces, and with teenage girls, be on the lookout for terrible hygiene associated with their periods. This one can get rather disgusting. So if you're having, say, multiple things on that list, congratulations, you might be dealing with unresolved trauma. Our resources at Trauma Drama University should be able to offer you a path to healing. Join us for free at www.traumadramauniversity.com. Please subscribe to our new YouTube channel for more information. We hope to see you next Tuesday when we'll be doing a book discussion. Bye-bye.